Good morning. This is Dr. James Lin. It's April 2nd, 2020. I just want to take this moment to update you on what we have been doing the last week and also what's coming up for this week. As some of you may know, yesterday around 5 o'clock, Rick Eberlin from the Command Center sent out a new memo. And the memo states that starting Thursday, April 2nd, I'm mandating that all staff in our facilities wear masks at all times. In each of the buildings, including all the office buildings, each staff member should be handed a mask at entry of each building for the use throughout the entire day. And unless it becomes soiled, you can wear the mask for the day. If it gets soiled, please ask your supervisors for another one. This will include anyone entering any of the buildings to go into any patient care areas from the outside, so people, vendors, etc. The VNA field staff should wear a new mask for every visit, and we have that outlined in a policy procedure that Kyle will update. All the other PPE precautions previously distributed should continue to be followed. During this crisis, the supplies are at its all-time low, but we're trying to take preventive measures to protect our employees. So please do not hoard and take any additional PPE if you don't need them. And I'll go into a little bit about our challenges of sourcing and supplies. As all of you know, that the COVID-19 is a pandemic worldwide. So as you can imagine, every country in the world is trying to get their hands on PPE gear as well as face masks. So there is actually a shortage and a price hike in raw materials. So it is very difficult to secure large quantities of supplies. So what I've been doing to make sure that we're able to follow through with this new change in policy is that I've been working internationally trying to get bulk large quantities of face masks for us, and the time difference between here and Asia is about 12 hours. So I've been up 3 o'clock in the morning every day trying to negotiate and secure the supplies for us. And I'm happy to report to you today, as of today, we have enough masks for the next 4 to 8 weeks. So therefore, we need to continue to conserve, and we need to use them, but very judiciously. And throughout this time, I'm going to continue to find new sources and try to secure equipment for us. And it's very important to me that all of you stay safe. In order for us to combat this virus, we need all the healthcare professionals to be healthy and safe, and that's why I'm instituting this. The other one I want to share with you is that I've always believed that wearing masks can prevent the spread since the beginning of this whole crisis. And I just want to share with all of you that there's a website called maskssavelives.org, and they have a nice graphical data to show that countries that don't have a mask wearing culture versus countries that do have mask wearing cultures, the number of deaths and the number of spread is pretty dramatic. So you can see here, Italy has approximately 12,500 deaths so far. In Taiwan, there are 5 deaths. In Spain, there are approximately 8,300 deaths. In Japan, there are 56. In the US, we're approaching 3,500. And in South Korea, they had 162 when they had their height of their pandemic. So it's just a brief sort of statistics to show you that the importance of wearing masks. And I can make a separate video to tell you the evidence behind it and some articles that has come out since the pandemic. They've studied different scenarios in hospital settings where wearing masks versus not wearing masks, the results of that. So if you have any more questions regarding this new change in policy, please contact the Command Center. And as always, we're always here to answer any questions. And if you have any concerns or questions, please don't hesitate to contact us, and we'll be happy to help you. So until next time, stay safe, and please wash your hands for 20 seconds. Thanks.